All right, good afternoon. My name is Marcus. I am in nursing school right here at York Tech. I'm here to do a full assessment on a newborn. So what we're going to end up doing is we're going to be gathering our supplies. I have my baby stethoscope, I have my measuring tape, and I have my pen light for check. I'll also be verbalizing that I do have gloves on. First thing what we're going to end up doing is I'm going to be doing hand hygiene when I walk into the room. I'm going to go in and introduce myself to the mom, give privacy, if possible, be shutting the door there. So the first thing I'm going to do, we're looking at just general observation of what the baby looks like. So we're looking at skin color when we first walk in, and for this infant right here, we're looking at normal color for is ethnicities, that what we see right here. For the posture that we're looking at here, we're looking at any closed for the arms there. The arms, they're usually about halfway bent, close to the core that itself for the body, to the body there. So then next we look at that portion. The head itself should be is 1/4 of the total length, and also the trunk. But also the upper limbs are usually a little longer than the lower limbs when you do your examination here. So the next thing you'll be looking at is the movement of the baby. They should be making their own movements, sometimes moving their arms, their legs, but sometimes their head side to side is what you're looking at. For the skin itself, you're looking for any trauma since it's just been born. You're looking for the skin is intact. Also, you're looking at for color, it's dry and also warm. Next thing we're going to go to is going to be looking at measurements. So the big thing with measurements here, the average weight that you're looking at for a newborn is between 2,500 and 4,000 grams. Average length is around 48 to 53 centimeters. Average head circumference is 32 to 36, and the chest circumference at the nipple line is around 30 to 33 centimeters. So what we're going to do now, we're going to do some quick measurements on the baby here just to illustrate. So what we end up doing is that we're going to get our tape, measure from top of the head to the foot. We're looking at probably about 36 centimeters for length. For the head, we are looking around, we're looking at about 32.5 centimeters. And for the chest, we measure around the upper line is around 35.5 right now. So all looking well there. So the next system that we're going to be looking to our assessment is going to be the respiratory. So the big thing is we're looking for respiratory rate. An average for a newborn is between 30 and 60 a minute. The technique that you would want to use are two. You could listen or observe, but the big thing what I like to do is to place my hand over the chest and just lightly on the chest, touching anywhere you can feel the baby breathe up and down. And you want to count for 1 full minute on this. So with that right there, there are some things you want to be looking for also when you're doing the respiratory system check. Assessment is that you want to check for their breath sounds, and so or the way they're, well, first of all, you want to check to see their respiratory, if they're in distress. Are they breathing shallow, fast? Are they grinding? Do they have nasal flaring? Do they have bluish tone to the skin? Muscle retraction or any wheezing that you can hear is what you're looking for. Now, as far as the technique for listening to breath sounds, is that if all possible, you'll have a baby stethoscope. So what you end up doing is you have the small bell. It's what you're going to be listening to for the breath sounds. So when listening up, you want to put your baby underneath, and you want to listen for each area of the infant for breathing, and you're looking just for any different breath sounds of if you hear any of the infant there. So with that being said, we're going to be also taking breath sounds, which I just showed there. But the big thing you need to keep in mind was the baby born by C-section? And if it is, that means you could have possibilities some fluid buildup still left in the lungs, because instead of being born by vaginal, those lungs the liquids are squeezed out of the lungs. But C-section, that is not. So, but over time they will diminish. But you want to keep an eye on that also. So the next thing what you want to listen to is the cardiac rate or the heart rate. And so an average rate you're looking at is 120 to 160 a minute. So So basically, it's the same thing. I listen to the breath sounds. With your stethoscope, you want to listen to the small bell side, and you want to listen to 1 full minute, and listen to there. So after you listen to the heart, getting the sound there, next you're going to go to, you want to palpate the brachial artery of the arm or the femoral pulse. And so what you're looking for here is that you're going on the upper brachial arm. You listen, you feel. So what you're looking for is rhythm, rate, and strength. So the rhythm would be, is it regular, irregular? Is the rate, is it normal? Is it thready? Is it bounding? And the last thing you want to look for is the strength. And so usually what you're looking for is +2 is a good normal pulse rate to feel right there. Now for your blood pressure, the average range is what you're looking for. For systolic, is between 65 and 95 for systolic, and you're looking around 30 to 60 diastolic. Usually we don't do a lot of blood pressures on infants because it can be very difficult to be done as far as oscillating, listening, because they're moving around a lot. If you have them all like also on a maybe a cardiac blood pressure machine, you can pick up a lot of artifact. You may not get a true blood pressure check there. So from there, we're going to go to the head. So when you're inspecting the head, what you're looking for is the suture lines here. There's a couple things you're going to be looking out for this right here. You may find some ridge lines for the suture lines for the head right there, from the compression of the head from being born. Another things you can look at the fontanelle. Two things, three different ways you're going to be looking, or what you're looking for. Flat is normal. Sunken can also mean for dehydration, and if you have a bulge in the fontanelle, then you're looking at ICP, which is intracranial pressure, which means comes from maybe an illness, which the doctor's going to look at a little bit more. So also what you're looking for with the head here is you may have a Kaput syndrome. I can't think of the name right there, but anyway, what you're looking at right there is a cone head. Maybe 3 centimeters is what you're looking at. Maybe a little bit of swelling of edema, but that will go away, also resolve on its own there. And so the next thing you'll see is you may have some cephalocleatoma, which is, it's a collection of blood or maybe some fluid up under the skin. And that's also could be just trauma from birth if they have to use, if any tongs were used or any tools to suction to move the baby out for help for delivery there. And that will go away on its own probably in a couple months. So the next part you're going to look at for the assessment, you're going to be looking at the eyes. You're going to be looking at the color. You're going to be looking at pupils. So usually the color is what you see here. They're usually dark in color, not yellow. Yellow, if you see yellow, it means it's jaundice. You don't want to see that. You want to see nice white there. For the pupils, you're looking for perla. And the only thing we're really looking for is looking for light accommodation. Do that real quick. And we do have light accommodation. Next is going to be for the ears, and what you're looking for the ears, you're looking for if they're symmetrical, and also is the top of the ears lying about even with the eyes. And so with also, I always like to take a quick look, is there any skin tags or do you have any discharge coming out from the ears? If there are maybe any skin tags, it could be indicated maybe for some hearing loss or a generic condition. You may want to get that looked at. Next, also, while you're here, you're going to look at the nostrils. The way you examine the nostrils is you can put a finger or two over the mouth, close one nostril. You want to hear for air coming out, and do the same for the other nostril. Repeat on the other side. From there, we're going to inspect the mouth. You want to take a gloved hand, slightly put it in the infant's mouth for rooting. It's a reflex for like a sucking on your pinky on the finger. And then next, you want to check for symmetrical evidence of any facial edema or swelling from birth. You want to make sure that it's equal there. From there, you're going to go for Epstein pearls. If present, what it is in the gums, is that you feel around on the gums of any slightly bumps. If you do, that's what those are there. Circumferential cyanosis, you're looking for around the mouth. If it's bluish in color, meaning will it be lack of oxygen, it may increase with crying that you see there. If it persists seriously, you may have to look into further. There may be a lung condition with oxygen exchange there. Next, you're going to go to the neck and the thorax. So for around the neck area, there'll be built up the skin. It's real thick there, looking for skin folds. You want to make sure that the head moves easily from side to side there. Make sure there is no webbing around the pad. That is abnormal if you're going to see that. Next, we're coming down, you're going to be looking at the chest. Inspecting for that is also you want your fingers each side of the clavicle, up at the top right there, and also the chest size. You want it like a symmetrical roundness and symmetrical when they breathe there. Nipples will be symmetrical, mid clavicle line there, and also the babies may have small buds due to increased hormones there. Next, you're going to go for the abdomen. And what you do when you're looking down at the abdomen right there, you want to listen. When you listen down to the abdomen, you should be, you may or may not hear sounds there, but also with that being done, you want to make sure that the abdomen is soft and not firm there, and also you want it round and symmetrical when seeing there. All right, with that being said, you're going to go down to the cord, and when you're seeing the cord here, you have two arteries and one vein. So what you're going to be looking at for color-wise, maybe a slight bluish white tint to it when it's fresh, but over in time that will go away. Now, if you see a bulge around the cord area, that may be possible as you might have a hernia there. Next, we're going to be dealing with extremities. So with extremities here, you want to grab the hands here, and it's called a moral reflex. You want to grab, but they should grab onto your fingers. You want to slightly spread them out, lift up, and you slightly let down. The baby should startle, which it will cause a reflex with the wrist, and I think it kind of feels like that. They feel like that they're falling there, and that's a normal finding that you're going to see. Next, come to the hips deflate. You're looking for hips dysphagia, and so what you do there, you want to grab the legs, you want to kind of roll them up slightly here and slightly out to each side. And what you're feeling for clicks. If you hear that, you may have some hip problems there that has to be looked at there. Next, it could be coming for the hands. Very natural for an effort to grab hold it to your fingers right there and grasp. And you want to open up and see, looking for a crease around the center of the hand, go across the entire palm there. Next, come to the feet. So what you're checking for is for extra digits, and we don't have any here. We have all 10. You want to check in between the toes, look for webbing, which there is not. Also, you want to check for reflexes right here. It's called plantar grafts. With infants, their toes are very flexible. They can also grab around your fingers there or an object when placed near it. Next, what you want to look at is the back. So you want to make sure the back is straight and it's flat when looking right there. And if you see any indication of any dimples down at the bottom there or tufts of hair, that could be kind of normal, but also it could be indication of spinal bifida, which you may have to get looked at there. Next, we're looking at the sacrum there, and you look for dimpling. Also can explain that could explain a little bit more if it is spinal bifida for a deeper spinal cord issue. I'm sorry there. Next, we're going to go for the buttocks. You're looking for symmetrical, looking for folds that are also equal around there, and if they're uneven, it could be maybe a sign of a hip dysplasia there. Also, with some races, usually it's more Alaska Native. You see it also with Asian race. It's called Mongolian spot. That's very normal to see. It's usually a blue or a gray marking that you have down at the base or just above the buttocks. You see there. If you have a female, you want to go to the genitals. So once you take a look down at the genital hills, look at the labia. For there, you're looking for any folds that look normal, that are symmetrical right there. And you're not looking, there may be a slight discharge, but that's normal right there to have. If it's a male, you're looking at the scrotum, bilateral with testes intact there. Observe the penis, the epi, and diffus. If I said that correctly, I'm sorry. Basically, looking for the any abnormal holes below on the gland of the head there. And also, you want to check with the anus for any fissions there or any trauma. So with that being said, our exam is over. So what you want to do is you want to take the baby, you want to cover up their head, swaddle the baby, give it back to the mother, perform clean hand hygiene, and place the bell call button to the mother, and the exam is done.